So before we go into, everything in this webinar, I want to touch base with you guys on what a bow tie question is and what it's really looking at. So it really assesses the clinical judgment. And I know a lot of this might seem like foreign language, but it'll make more sense as we go through the webinar. So there are 6 steps of the clinical judgment measurement model, and that's what is being tested on these bow tie questions. So we are going to be looking at how we recognize cues, analyze cues, prioritize hypotheses, generate solutions, taking action, and then evaluating outcomes. And we're going to break each of these steps down as we go through our bow tie question. Okay, so what is a bow tie question? Great question here. So parts of the bow tie. You're going to be given your instructions, and those are pretty standard. It's telling you to complete the diagram, and it gives you all the information you need. Then you're going to have scenario and data tabs. Now, the scenario is going to be like what's happening with the client. You might have data tabs that could be vital signs or head-to-toe assessment. It could be nurse's note, progress notes. Anything is fair game there. So you're going to look through all your data tabs when you get these questions. Then you have these headers that you see here. So you are given actions to take, potential conditions that they're experiencing, and then parameters to monitor. So each of these answer options on the side are going to have 4 to 5 choices, and then you'll have 4 in the center here for what their potential condition is. And then of course our answer spaces up here at the top. You'll drag your responses in there, and it's going to make what looks like a bow tie. Will you see this on your NCLEX? So the question here, or the answer here, is that they show up after you've completed 85 questions on the NCLEX, or it could show up before as a pre-test item. So you might see it, but if it's before 85 questions, it's a pre-test item. And then scoring. The good news with these bow tie questions is that they're partial credit, right? That's really helpful. So you're not going to get, it's not all or nothing. So you're going to get 1 point for each correct, and you can get a total of 5 points. Let's talk through some strategies, because that's what's really important here to help you as you're taking on these questions and know how to approach it. First, you're going to read the scenario, review any of the data tabs. So up here, you can see this one has a health history and vital signs. So you're going to review those in their entirety. As you read through those, I want you to ask yourself if each finding is normal and expected, or if it's abnormal and concerning. And as we go through the example today, I'm going to be asking you all to tell me if you think it's normal and expected, or if it's concerning. Then you're going to consider each of these columns separately. So you're going to take it on one by one and think of them either as a multiple choice question or a select N question. So in the center here, when we're picking our potential condition, we're going to pick that first. We have to know what the client's experiencing in order to know what actions to take and what parameters to monitor. So this is going to be a single best. You have 4 options, ignore everything else, and pick what is most likely occurring for this client. And then you're going to look at your left and your right columns and determine actions to take and parameters to monitor. And this is looked at as a select N, which just means you're selecting 2. N is standing for the number that the NCLEX wants you to pick. And here they want you to pick 2 from each. So you'll pick 2 actions and then 2 parameters to monitor.